Hello, good afternoon, everybody. My name is Dr. Lim, as suggested on the board. Now, I believe Dr. Ariel has spoken a lot on sleep and recovery. And so I'm going to dedicate the 10-minute slot that is given to me to talk about the second thing that MLife has been focusing on, which is cell regeneration, cell therapy. And it is actually very important as well as part of health as overall. So in general, if you have better health quality, then you get better sleep. Does it make sense? Makes sense, right? Okay, so and the most popular topic, I guess, for the past 2 years is the pandemic and COVID-19. So I'm just focusing on this for 10 minutes. So what I've done is I've collected a lot of data and I've gone through them and I've compiled them to share with you. And the two things I'm going to focus on today is basically COVID-19 and long COVID and its after effects, including immunity, cell degeneration and whatnot, and also how cell therapy serves as a repair mechanism or recovery mechanism for those suffering from COVID-19. And the data I'll be sharing is international data. So if you look at the study, COVID-19 and organ damage, all right, so what I've done is I don't just look at individual studies, I look at meta-analysis, which is a compilation of multiple studies internationally. And these are some of the studies that we have came across and collected. So based on this meta-analysis, 124 studies on organ damage has been reviewed as a result of COVID-19. And it's been patients have been followed up from between 4 to 22 weeks. And we can see a trend of heart, lungs, kidney damage, stroke, diabetes, and blood clotting disorders as well. And for patients that are hospitalized, suggesting they have more severe form of COVID, the rate of organ damage is higher than non-hospitalized patients. The title, the references are all there. We can share the slides later in case you want to do a deeper dive of all these studies. You can get information on that. Now, damage from long COVID is very common as well, as we see in especially with patients that are hospitalized slightly older. And so in this review, about 47,000 patients have been studied, and 80% develop one or more long-term symptoms, consistent with Dr. Ariel's data just now about 80% of people having effect from long COVID. And the 5 most common symptoms were fatigue, headache, attention disorder, hair loss, interestingly, difficulty breathing. So these are the common symptoms of damage from long COVID. All these are, of course, as a result of organ damage, cell degeneration, resulting in these effects or these complications, I would say. So further studies to also suggest more damage from long COVID as well. Some of the major findings, mechanisms, and recommendations by this study. We see that immune cells and immunity is affected for those suffering from long COVID. Not necessarily just long COVID, but those with COVID as well, severe COVID as well. Many of them suffer from immune cells and immunity. Their immune system is affected. Again, blood vessels damaged. We see heart, lungs, kidney, liver, pancreas, spleen damage. Brain and nerve damages as well, reproductive system damage, breathing, digestive tract. Basically, the whole body system is pretty much affected in summary, right? Of course, the mechanism of how COVID disrupts or destroy all these mechanisms is quite a long topic by itself. So we won't be going into details, but if you just do a simple Google, you will see the mechanism of how COVID affect other organs besides just the lung and the breathing tract. So some symptoms in pathology, heart, people start experiencing chest pain and palpitations, cardiac impairment, the heart function starts to deteriorate. We see people suffering from heart attack as well. POTS is palpitations or racing heart rate due to change of position, rapid change of position. On the lungs, we see people with cough, long cough. Dyspnea simply means difficulty in breathing, abnormal gas exchange in the lungs. We see in the immune system, we see autoimmunity, MCAS. Of course, these are all details that you can go into. Pancreas, we see diabetes, pancreatic injury as a result of COVID. And gastrointestinal tract, which is our digestive system. We see people experience a lot of abdominal pain, nausea. Gut dysbiosis means the gut microbes in the gut starts to change. And we see also viral persistence and viral reservoir, viral retaining the body, COVID virus as a result. So neurological issues, cognitive impairment, We see fatigue, we see disordered sleep as well, as mentioned by Dr. Ariel. Memory loss, tinnitus, dysautonomia, all these technical terms, neuroinflammation, reduced blood flow to the brain. We see kidney, spleen, and liver, organ injuries, blood vessels, fatigue. We see people with blood clotting disorders, vein blockages, and stroke and whatnot. And reproductive system as well, surprisingly, we see people, men affected with erectile dysfunction, increased severity and number of premenstrual symptoms, irregular menstruation, reduced sperm count. All these are effects of long COVID. And these are all, again, very closely related to cell degeneration as a result of COVID. Again, more studies, 194 studies, totaling 700 over 1,000 participants, including children. 45% of COVID-19 survivors experience symptoms at 4 months, and this is pretty much irrespective to age and sex. But in terms of race, there are still more studies being done, so it's not conclusive yet. Basically, it affects everybody, right? So the current COVID-19 treatment strategies are actually, I would say, a lot focused on the symptoms, right? So supportive therapy like oxygen, ventilation, giving hydration through drips, symptomatic medication to reduce the mucus and inflammation. These are what the hospital or even the outpatient doctors, primary care doctors prescribe. We currently see antiviral treatment like Paxlovid, for example, but there are a lot of side effects when it comes to Paxlovid treatment as well. And then after COVID, we see a lot of rehabilitation, breathing exercises, physiotherapy, and we also see some mysterious treatment as well, Lianhua, colloidal silver, aromatherapy, some form of tea. So we don't know all these things, whether they work or not, because not enough data have been provided. So in many cases, lung structure and lung cells are damaged during COVID episode, all right? Besides all the organs, of course, lungs is the most directly affected organ by the COVID virus. And the current strategies may keep us alive, all right? That means, give you oxygen, help deal with the mucus, help you deal with symptoms. But the reason why people have long COVID is because the cells that has been damaged during the COVID episode have not been recovered, right? Not just on our lungs and other organs as well, right? So now we start looking at stem cells, right? MSC stands for mesenchymal stem cells. Now it's getting more and more, there's more and more awareness now in Malaysia regarding the use of mesenchymal stem cells. And again, I was looking at different studies on how MSC affect people with COVID, right? So there are over 80 clinical trials registered now. And there are some safe, some effectiveness in, okay, it is suggested that there is safe and there's some effectiveness in preclinical and clinical studies. So the whole diagram is very complicated, but let me just draw your attention to the bottom 3 things. In general, what we understand from the studies in the market right now, that how mesenchymal stem cells affect the recovery of the cells or cell regeneration is through tissue repair and regeneration. It has anti-inflammatory effect, and it also has anti-fibrosis effect, which is to stop the lung from scarring. Now, if you look at the roles of MSC, again, these are recent studies that have come out. So everything I share is 2021 and after. It regulates the immune system to prevent cytokine release syndrome. It promotes endogenous repair by releasing various paracrine factors and exosomes. So basically, this is how the MSC goes into our body and helps in terms of reducing of inflammation and promoting cell repair. Right. More studies to suggest the effectiveness of MSC. So antiviral infection. So we have cell repair, which is also suggested by MSC, the effectiveness through MSC. Tissue repair, regeneration, and immunomodulation. So not just about repairing the cells, it also helps our body regulates its immune system as well. Again, these are all very technical, but let me draw attention to the properties which is antiviral, cell repair, tissue repair, regeneration, and immune modulation, restoring the immune system of the body. So these are some summary. So migration and homing. So when the organ cells is damaged, when we infuse MSC, mesenchymal stem cells in the body, it actually goes to the targeted organ where it's damaged and it actually introduces repair. All right, these are all based on the studies that we have, not claims that I make. All right, these are all based on data that is available in the world. Now, immune regulation, it deals with the cytokine system of the body. anti-inflammatory factors. It reduces inflammation. So what COVID does to our lungs and our organs is causes inflammation. And MSC actually has properties to reduce the inflammation. Extracellular vesicles, these are basically the exosomes that directs the stem cells to, where the repair requires to create targeted repair. Differentiation means the cell actually goes to the organ that is affected and it differentiates and it causes repair in the body. Antiviral effects, anti-apoptotic, which is the cell damage, cell death. It actually slows that down and reverses cell damage and cell death as well. All right, so that's all. I think it's a lot of information. We'll have the slides shared with you all after this. Thank you.